Welcome you all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about fibrinolytic drugs and their uses. Okay. So first of all, these fibrinolytic drugs are used to lyse thrombi in blood vessels by activating fibrinolytic system. That means plasminogen to plasmin. This plasmin will act on insoluble fibrin to soluble fibrin, thereby clot will get dissolved. Okay. So if you are using these fibrinolytic drugs in both conditions like arterial and venous, this venous thrombi are get more lysed easily compared to arterial thrombi. Okay. That means venous, if you are using in both conditions, venous thrombi are easily get lysed compared to arterial thrombi. And if you are using in both conditions like acute one and chronic one, it will be easily to melt acute one, that is recent thrombi compared to older ones, that means chronic thrombus. Okay, so these thrombolytic agents doesn't distinguish between pathological thrombi and normal fibrin deposits, that means healing conditions, normal physiological fibrin deposits. So obviously they will doesn't differentiate that pathological and physiological, so they dissolve all fibrin deposits. So obviously what will happen? Bleeding. So hemorrhage is a major side effect of these fibrinolytic drugs. Okay. So what are the drugs we will have in this group? Streptokinase, altiplase, retiplase, tenecteplase, urokinase. These are all drugs I already discussed in MI. When you are discussing in a CVS system, in the MI we already discussed all these drugs and their uses. Okay, that's why we just here will observe the mechanism action and their uses. Okay. Okay, next we will see that mechanism action of fibrinolytic drugs. These fibrinolytic drugs mainly activate plasminogen to plasmin. This plasmin will act on insoluble fibrin. So thereby it will convert to soluble fibrin. Once it will convert to soluble fibrin, obviously clot will get dissolved. Okay. So for this activation, what are the drugs we'll have? So we'll have streptokinase, altiplase, retiplase, urokinase. All these drugs are tissue plasminogen activators. They activate plasminogen to plasmin. This plasmin will act on fibrin, that is insoluble fibrin. Then it will convert to soluble fibrin. Okay. These are all drugs fibrinolytic. So what are the therapeutic uses of these fibrinolytic drugs? So where we will use obviously myocardial infarction, angina pectoris, unstable angina, and sometimes we will use in fibrin deposits like DVT, deep venous thrombosis. In those some conditions we will use these fibrinolytic drugs. Here some other drugs also there. This is aminocarporic acid. It is inhibiting this tissue plasminogen activators. These drugs are antifibrinolytic drugs. What are those? Aminocarporic acid, tranexamic acid. They inhibit these tissue plasminogen activators. Thereby obviously no conversion of plasminogen to plasmin. So there will be no fibrin dissolution. So obviously fibrin will get accumulated. It will helpful in coagulation. So antifibrinolytic drugs are helpful in formation of coagulation. So these fibrinolytic drugs, they will dissolve the clot. Okay. Thank you.